I'm Amanda, and I am the owner of Illuminate Communicate and a speech language pathologist and homeschool graduate. If you've ever wondered what to do when you want to homeschool but your child needs speech therapy, stay tuned. We're going to be learning about that right now. I don't know if you've noticed, but there are a lot of different options out there, and some of them can really depend on where you're at. Some places have very few options, and overall, there are so many options that you can get incredibly overwhelmed. Different blogs, different principals, different books. Not to mention all the different ways you can get speech therapy, whether through a hospital or a clinic or teletherapy through a big company or through your public school system. There's so many different options. And that's not even talking about how to pay for it, how to find it, how to get there, the location where it's held. So many different things to think about. So today we're going to get a little bit of an overview. Because there's so many different options, our goal today is not to show you every single option available to you specifically. That would be really difficult because the options out there is individual as your situation, and your fit will be very different from other people's fit. There's no perfect next step. But our goal today is to help give you a map of where to start looking, to give you an idea of what could be around you so that you can look into whether or not that's a good fit for you. And then also to give you some questions to get you thinking about, would that be a good option for me? Or is there something else that's a better fit? And how do I find out? One of the biggest things to consider when you're mapping your journey is not to go it alone. This is going to be a bit of a process. That's why they call it a journey. It's not something that necessarily you do one procedure, like let's say fixing a broken leg, you do the surgery and then it's on to the next path in healing. It could be different. It could be different from your child, from another child. So you may need more encouragers, more guides than you might have expected originally. You might need somebody who's kind of gone before, who can walk you through things. You might need to contact different professionals to make sure that you know everything you need to know about the speech and language side of things, so that you can support your child with all the knowledge that you know about your child being their expert. Also, definitely continue to consider that there isn't one perfect path. If you make one wrong move, it's not necessarily a wrong move. It might be a step to the side to enjoy the beautiful bluebird that you see on the side of the road. It might be that you have to go over a stump or a muddy patch that you weren't expecting, but it's still a journey. You're still going where you want to go. And as long as you have that flexible forward momentum, it can still be a beautiful ride. And with that, flexing confidently. When you flex confidently, you'll enjoy the journey. When you flex confidently and enjoy the journey, your child will learn more. So those are the things I want you to be thinking about. When you're hearing all of these different options, don't panic because there isn't necessarily a wrong move. I have worked with so many different families who have chosen one thing, taken a moment and either appreciated it because it was good in that moment or for that time, but then they switched gears because either they needed something different or they needed something different then after they learned what they needed to learn with the first location, the first type of therapy, the first SLP, or the first professional. It's okay to change and to flex as long as you're confident in how you go, which is more of a mindset than knowing everything. You know it's going to work out okay. It's going to be all right. And one of the ways that I know you're going to be successful is you're a homeschool parent or you're considering being a homeschool parent. So you love to be involved. You have this drive to be involved and have that family-driven kind of feel. So ask questions, learn techniques. If you have a speech language pathologist, ask them questions. Ask them to learn techniques. Don't just sit in the waiting room during a session. Come in, observe, learn. Ask to be trained. It's backed by research that when you have a parent who's that home field advantage, that's that child expert because you are your child's expert, you know their patterns better than anybody else does, even when sometimes you might not feel like it. Still, it's backed by research that parents who are involved get way more bang for their buck in terms of speech therapy. So, with all of that in mind, thinking forward towards all those different options that you may or may not have accessible to you based on where you are and what may or may not be your best fit, know that you are the secret sauce. You are the thing that makes a huge amount of difference in prognosis, which is, trajectory and how well that child will do as they're making progress forward. I just really want you to know that you are that secret sauce. You are that special extra thing that makes the difference. And so, again, like we were talking before, there's no wrong answer. There's no misstep on the path that's going to completely break you. So let's look at all those options. We're not going to get overwhelmed. And you know that you can flex confidently because you're on this team. You have it. The first kind of speech therapy resource we're going to talk about is government programs. There's a lot of different government programs that provide free or reduced cost or just easy to find speech therapy options. And one of the most common ones is early intervention. So early intervention is usually that 0 to 3 years old, birth to 3. And if you search your state early intervention, you're going to find it. Also, if you want to find that is something that is within my starter kit that I believe will be in the swag bag or something cool like that. But you can also find it on my website, www.illuminatecommunicate.com. You're going to find a link to the Homeschooler's Guide to Speech Therapy Starter Kit. And that starter kit is all about resources that you can find and how to find that. Think about it as kind of like the buddy to this webinar, actually. But it goes into the finding process a little bit deeper, definitely a deeper dive in that printable. So the early intervention, search your state, search early intervention government program and see what comes up. Here in Indiana, we call it First Steps, and it is 0 to 3. And it is a wonderful resource. Absolutely wonderful resource. And I will talk about some of the pros and cons of it in just a minute. Scholarships and grants also exist. We don't, that I know of, have one in my state for speech therapy, although we do have it for some of the resources like tools and special devices. We also have government-funded colleges that have speech and language programs for study. So when I went to my graduate program, I was in a speech and language program, and we had a clinic for us to get to practice. And I can tell you that working with a student can be a really wonderful thing for you and your family, because those students are highly motivated to do the absolute best job possible every single time because they're getting a grade. And they have their clinical supervisors there at all times. In my program, we also had a senior student clinician also be on site and facilitating at all times. It was a really great thing. And a lot of times they offer sliding scales. Sometimes they even offer free evaluations and free treatment if you qualify to be a participant in a study, if that's something you feel comfortable with. I remember when I went to my graduate program, I was the research assistant in the Disfluency Laboratory, where we worked with children who stuttered. And we would do free evaluations for speech, language, and disfluency, stuttering, and then see how different children would respond to different testing and treatment. And it was really neat. And it was a free resource. One of our students even ended up getting a free speech and language preschool because they were in one of our studies. So it's a really neat resource. Additionally, there's also nonprofits, and sometimes those can be national or state or local based. And so that's another way to look up nonprofit speech therapy resource and see if there's a way to connect to that. It might come up at the same time you look for scholarships and grants. The early intervention pros and cons, I do want to chat with them about them just a little bit because every state is different. And a lot of times people will share that early intervention is the best way to go for one reason, because earlier you intervene, the better chance of progress and the better chance that the overall academic impact will be reduced. But And one of the things that you need to consider with early intervention is cost, because sometimes early intervention is not free. Usually it is the assumption that early intervention is free for absolutely everyone because it usually is operated under government subsidies. However, that is not always the case. There were a few times where I was working in the early intervention program here in Indiana called First Steps. It's pretty cool. However, families would have to discontinue services because they were in this interesting bubble where on the sliding scale, or when their insurance was being billed for the First Steps early intervention services that came to their home and were so wonderfully parent coaching oriented, they were charged very, very heavily, and they had to discontinue services and were hit with a bill that they weren't expecting because most people assume early intervention is free. That is not always the case. But you should check because it could be free for you. And it is one of the best resources out there because it's in your home. It is supposed to be parent training driven, which is just perfect. Just perfect. Because again, you are the secret sauce. We want to equip you so that you can do amazing, amazing things with your child. So definitely take a look into that. Ask, here in Indiana, we have your service coordinator, the person who helps you find your services and coordinate them. Ask them to talk to somebody in billing in order that they can run your insurance and see what the cost will be to you. Sometimes I had families where it was $6 for a session, which is pretty reasonable, right? And then for other families, they would be hit with a bill after having weekly therapy for a month, and it would be $2,000. True story. I won't tell you the other ones. They might make you cry. They probably made me cry, knowing me and just the heartache of a family thinking they're getting free services and they're not. But then other times, as in the majority of the time, as in like probably 70 to 80% of the time, they were free services and it was wonderful. So always double check, but don't always assume. Another resource to consider are public schools. Your local education agency is bound by IDEA to provide certain services under Article 7. So look up IDEA, look up Article 7, look up speech therapy, and see what you get. Also, check your Department of Education because they will give you different ideas based on your state, because each state is allowed to interpret IDEA and Article 7 differently. And one more thing to consider with that is that IEP and ISP, an individualized education plan, and an individualized service plan, not every child who has a speech disorder qualifies for services. Not every child who has a language disorder qualifies for services. And here's why. They need to look for two big things. One is the presence of a disorder or a delay that is a certain level of significance. And some states interpret that as very significant. There needs to be a lot of disorder going on, a lot of delay going on. It needs to be measured by a standardized assessment and be this amount of severity. And that's cool under IDEA with Article 7, as long as that's the way that the State Department of Education has interpreted it. Now, there are other places like my state that are a little bit more flexible. They allow us as clinicians, as speech language pathologists, to go in there and go, well, that particular speech sound that they're making is not typical for their age. They are kind of on the borderline, but that is enough of a disorder for me to tell that it's definitely different. There is something going on there, which I really appreciate. I like that little bit of professional respect. But the other thing that we have to look in is not just whether or not there is a disorder or a delay that's significant enough according to whatever the standards are in that state, but we also have to show academic impact. And that academic impact is a really important piece. If there's no academic impact, there is no IEP. So what does academic impact mean? What does that look like? It means that there's an impact to their access to the educational environment. Now, that's a big, big key difference. When you work with like a clinic or government programs or private speech therapy, we're not necessarily looking to see if you can access your academic environment, we're looking to see if you're reaching your full potential, right? That's what we're shooting for, especially in private practice, because when we're not working with insurance companies, we don't have to say that you're typical. We get to say, are you typical for you? Or have you reached your goals, which is pretty cool. I like to be able to push as far as a child wants to go, as far as a family wants to go. That feels really, really good. But in a school, they're looking for academic impact. So if your child is B's and C's and D's, that doesn't necessarily count as academic impact, especially in the home environment, because it's really hard to show, hey, my child is behind in the home environment. And they might be like, well, it's not the public school environment, so there's no academic impact. They have different things that they can say depending on what state you're in. It really does depend on the state. One more reason to double check, right? Also, another thing that can help with the academic impact, let's say you have a straight A student. They are doing fantastic, but they do have some social language deficits related to certain varieties of the autism spectrum, where they are on the autism spectrum. Maybe they have difficulty with theory of mind or conversation skills, and that impacts them at a social level that makes it really hard for them to collaborate or to communicate with a teacher without extensive facilitation or additional accommodations when they need to give presentations. That would be academic impact. So there's lots of different ways to look at academic impact, but it does have to be found in order for your child to receive services in the public schools. If you have a question about why your child did not qualify, or if you have a concern about the type of services your child is getting when you feel they should have more, there is an appeals process outlined in Article 7. You should take a peek at it. I have already given you some Indiana examples, so we're going to go ahead and move on. And we have another option, private speech therapy. Now, that might sound kind of bougie and fancy and super, super expensive. However, like most things that we've talked about, you got to investigate. It might actually be a really good fit for you. First, we'll talk about locations. You can go to a clinic, you can have them come to your home, or you can do teletherapy literally wherever you are. That is an awesome option if you're somebody who travels a lot, because if you're living in an RV, you may not be able to go visit a clinic every week. You may not be able to visit a clinic every month because you might be somewhere new and exciting, and I'm getting a little bit jealous just talking about it. But those different places are all good options. Whatever is a good fit for you, that sounds great, right? The next part that we need to talk about is the way to pay. And there's 3 categories that I would like to introduce you to. 2, I think, will be very obvious, very, very commonly known, and that's insurance and private pay. So insurance, obviously, if you have insurance, that's awesome. If they cover speech therapy, even better. The question is, how much do they cover? How many sessions? Is there co-insurance? How much is your copay? Do you, because you are getting your treatment through a insurance plan, do you have a limit to only a 30-minute or 45-minute session when you really feel that your child would do best with maybe more than one a week, or a hour-long session or a 45-minute session? Do you have multiple children? And because of that, does it get really expensive because of the co-insurance? And if you could maybe break up an hour and train you and do little check-ins with each one of your children, would that be less expensive than doing a whole bunch of insurance sessions, insurance paid sessions? It really just kind of depends on how good your insurance is and whether or not you need something slightly different. Again, so individual, right? Private pay, obviously, is that big scary option that sometimes people talk about, like, whoa, private pay speech therapy, that's pretty fancy. But if you're like me and you don't have an insurance company, because I use a Christian health sharing ministry, which I love, and is actually, ironically, the better fit for us financially as a family because we're a larger family. And on top of that, it just feels really wonderful and feels like a spiritual good fit for us. If you are in one of those, you may not have coverage for speech therapy, or if you have an insurance company that does not cover speech therapy whatsoever, private pay actually might be the better benefit for you. You might be able to get it on a sliding scale, and it might actually be cheaper than other people's insurance option. It just depends, which is why it's so important to check at different locations, check with different programs, whether it would be cheaper for you to use your HSA account or your FSA account to pay for speech therapy, or if it would be better for you to go the private pay route, for you to use your insurance deductible versus not, like all those different things. There's so many options there. But an option that you may not have considered is private pay only. And this is what I'm going to discuss the difference between private pay and private pay only. The difference is private pay are people who are clinicians who accept insurance but also have a private pay rate, versus private pay only are a speech language pathologist who only takes private pay. Now, sometimes private pay only speech language pathologists are super crazy awesome specialists who charge a lot because, let's say, they only work with opera singers who are repairing vocal nodes after surgery. Like, they could be really, really specialized, and sometimes that comes with a higher price point. However, a lot of times when private practices take insurance as well, it impacts their private pay rate. And this is how this happens. An insurance company says, I will credential you with my insurance company, and all my in-network doctors can refer people to you, so you get a lot more patients. The speech language pathologist says, that's awesome. I would love to have more patients and help more families. And then the insurance company says, well, I will reimburse you 25% of whatever your private pay rate is. And in order to make a livable wage and to be able to keep their business in operation when they take a certain amount of insurance companies, or certain insurance companies, especially Medicaid and Medicare, depending on what states they're in, all of a sudden they have to raise that private pay rate more than they might have originally charged in order to, when they only get the 25% back, when they only get the 50% back from the insurance company, so that they have enough to kind of make ends meet. There are a lot of speech language pathologists I know who are holding on to their private practices just with their bare hands and the strength of will, because they desperately want to help families who are say, have Medicaid or certain types of health insurance, but they desperately use those private pay patients in order to kind of balance out the not being paid enough to keep the lights on in their building, and then the being paid more to kind of make up for things. So what that can lead to is, if you are a private pay person, if you look for private pay speech language pathologist, but you find somebody who also takes insurance or takes Medicaid, you may find that the rate is actually artificially higher than if you found someone who's private pay only. A lot of times, the private pay only speech language pathologist practice that I am acquainted with, they are the least expensive option unless your insurance company does an amazing job of paying for your speech therapy. So it's definitely something to consider. Ask if somebody knows someone who's private pay only. I also have a directory that I am growing with private pay only speech language pathologists across the nation, because it's really important to me that people have all the different options in front of them, because sometimes, like me, if you have a little bit different setup for your family and you don't have typical insurance, or your insurance doesn't cover it, which when I polled an audience of about 30,000 parents of children who had speech and language delays, about 50% said that it wasn't completely covered by their insurance. It could be you. So you might want to consider looking into private pay only. Just breaking down the pros of insurance versus private pay a little bit more. With insurance, it can get you in at different places. Sometimes you have to have a referral in order to get at some places. I don't know why that is, but it's like it gets your foot in the door. Even if they have a wait list a mile long, if they hear from your doctor that, oh man, this kiddo needs you, I'm referring them specially, all of a sudden it can open up doors in fun new ways. Also, when you've already paid for it, you've already paid for it. So why not make the most of that money that you've already kind of reserved towards that kind of process? Bang for your buck, right? If it's already working for you, let's make it work for you. But then private pay, sometimes it is actually cheaper. You might not expect it, but sometimes it really is, especially when it's private pay only. Also, it can be more flexible. Do you remember that example that I gave you about having a bazillion children who need speech therapy, but a mom who only has time for, let's say, 1 hour a week and who can only afford 1 hour a week? If you have insurance, an insurance company is not going to let you split up an hour session between 3, 4, 5 kids. Maybe a speech language pathologist would do that if they were going to bill as a group session, but chances are they will do what I normally see them do, and that is have you rotate. Which child is the most concerning to you? And then you'll work with that child getting speech therapy services for 6 weeks, and then you'll come for the next one for 6 weeks, et cetera, et cetera, et cetera. And that can feel like choosing between your children, for one thing. But also, if it's a matter of convenience and training, if you're going to be learning those different things with one child, why not learn them with all the children at once? So the nice thing about private pay, it can be flexible. If you can only afford one time a month, you can only afford one time a month. I have a family right now. They see me about every 2 months because life got really hard for them. And that's okay. I don't have to prove to an insurance company, oh, by the way, so-and-so really still needs you. And they're thinking, well, they haven't come in like a month. And I'll be like, oh, yes, it may be true. They haven't come in a month, but they really, really do still need speech therapy. And they're very motivated, I promise. But with private pay, it's completely up to you as the adult to say, hey, we'd love to see you the first Friday of every month. How does that work for you? And if the speech language pathologist can do that in good conscience, it works out really, really well. There's flexibility there. Also, you can stuff those multiple training sessions into 1 hour. I have multiple times worked with multiple children with one mom. So I will do a quick check, see how everybody's doing, and then I will move to training mom. The kids will kind of do their own thing, maybe reading a book or playing with toys in the nearby area so that me and mom can talk. And the moment I say, okay, grab so-and-so, we're going to do an example. She grabs so-and-so, we practice the skill, and she takes that as her homework for the rest of the week, 2 weeks, 3 weeks, or a month. So yes, lots of kind of neat options with that. Oh, not to mention, you aren't bound by network, so you can pick and choose who you want. And that can work for private pay and private pay only. The last resource category that we're going to be talking about is a really wide one. It's doing things on your own. There's books, there's tons of videos, there's courses, there's printables, there's the beloved search bar that can find you all of the books, videos, courses, and printables, blog posts, and you name it. Forums for sharing, groups for having support on Facebook, which I do have one if you want to join it. Speech Therapy at Home Community with Amanda Owens. I'd love to have you there. We talk a lot about speech and language. So feel free to join for that emotional support and sometimes a little bit of know-how and direction. But also, when you're looking through all those different things, sometimes you have to consider, is this a good fit for me? Is it okay for me to do it on my own? And if you're asking yourself this question, let me share with you some times when working on your own is good. So it is good when you just need a little something. Let's say your child is doing incredibly well with reading and writing and all sorts of language concepts, but they flip-flop their pronouns all the time. So they're using she and her interchangeably. They're saying her went to the store, and you're like, no, she went to the store. That would be a great thing to see if you could work with on your own and see if you can fix that without necessarily having to go through an evaluation and all of the financial process as well. That's a great time to do it on your own. When your child has trouble with a speech sound, especially when it's like just one or two, that's a good time to try things on your own and see how far you get. Sometimes that's all you need is somebody showing you in a video, oh, that's where the sound is made. I need to put my tongue between my teeth for the TH sound. No wonder it keeps coming out like an F every time I use my lip. It might be all you need. And if it is, fantastic. Fantastic. You found your fit, and that's perfect. But another time it could also be a good fit for you to do things on your own that is a little bit harder for me to bear is when you have no other access. I get in touch with families all the time who have no other access, either finances, not being able to leave their home and not having any good teletherapy options, which that is going to open up because the Interstate Compact is making it so that more and more speech language pathologists can provide teletherapy to more and more states without jumping through all sorts of hoops. Because if we're qualified in one state, they're going to qualify us in all the states that we need to be working in. So exciting, so exciting. However, there are still families out there who are really rural. They come out to get internet like I do when they're at another location, and they might not have teletherapy at home, et cetera, et cetera. There are so many different reasons why a family can have no access to speech therapy, not to mention being in a different country where there maybe aren't any speech language pathologists being trained. There might not be any speech language pathologists that speak the language that your child speaks. I've worked with a child who only spoke Haitian Creole, and we had to use an interpreter who hadn't spoke Haitian Creole other than interpreting, golly, since they were probably 6 or 7 years old. Sometimes there's just differences with access. And when that happens, by all means, dive in, equip yourself with books, videos, courses, printables, the search bar. See if there's anything you need to even interpret what your speech language pathologist is doing and get some cultural perspective from a blog post. It's good to combine. I love that. Also, when you really love to be involved and you just want more, when you really love to be involved, homeschool parents, and you just want more, you want training, you want equipped, maybe you're not allowed in your speech therapy room. That happens all the time at a public school. They can't have you in the same room as another student while they're getting therapy. If they do, it's a violation of both HIPAA and FERPA. So it's really important. It is really important when you love to be involved to get that training. And you might get that through your speech language pathologist. You might get that through the books, the videos, the courses, the printables, the search bar. But one of the things that I would really love you to think about is what to do when you're getting overwhelmed with the on your own option, or on your own in addition to working with a speech language pathologist, maybe in an environment or setting where they are not necessarily providing you the training that maybe you would like to have. So another option that I would like for you to consider when you're doing things on your own, when you're getting really overwhelmed, is going to a source that you trust to help you kind of figure out what's the most efficient approach for your particular situation. Having someone who can come in and say, awesome, you've got so many great resources, but did you know if you cut down to just this one, and this one, it'll save you time and you actually might get more progress because you're more focused in your treatment? That would be really nice, wouldn't it? Somebody who could confirm, yes, that is a brilliant idea. You should totally give that a try. I'm so glad it's working for you. Or to bring up other concerns that you might not have thought about. You aren't necessarily an expert in speech and language, even though you are a wonderful expert in your child and likely on your way or an expert, an experienced teacher in your homeschool. So what a speech language pathologist can give you is that sounding board and that expert opinion when you have questions about, well, Is it okay to do this on my own, or do I need a little something more? Is there something else going on underlying? I'm going to share a little story. I gave a free screening to a local homeschool cooperative, and I had a lot of fun working with a sibling pair. And one of the siblings came in, worked with a child, said, "Hey, I bet you could fix this, this, and this on your own. If it's not fixed in about 3 to 6 months, that's when that will become a problem." Mom was really grateful. Everything was exciting. I gave them some resources. We moved on. Then the next child came. And the next child was kind of just added as a last moment, like, well, I don't know, go ahead and listen to them. They have a couple speech sounds too, but they're a similar age, so it's probably just fine. But the moment I listened to that child, I heard, big word here, craniofacial anomaly. I heard hypernasality. I heard potential for an orofacial myofunctional disorder and a need for, at the very least, therapy. But I had concerns about airway patency. And I'm throwing out all these big words, not to be impressive, but to just show that sometimes what seems like no big deal, like having a sweet, cute, tiny little voice, sometimes can actually be a really big concern. And a speech language pathologist, sometimes in 5 minutes, we can go, oh, there's a little something there that might be a bigger something, and I need to ask questions. When I started to ask questions, I found out that that child had really restless legs when they were sleeping. They were snoring when they were sleeping. They had a resting oral posture that was, and they had a lot of ear infections. They had a lot of different concerns that all added up together as a red alert, this is a problem. So I sat that mom down through my teletherapy lens and said, "Hey, mama, these are the things. I do not want to scare you, but these could be big. Take a look at them. Take a look at them and see what your child may or may not need. Ask about this." That mama did. That child is being seen by the craniofacial anomalies team expert, like the expert, the person that I've read his name on all the paperwork and been like, "Oh my goodness, Dr. So-and-so." It's like speech language pathology celebrity, right? So just hearing about that child and how they're going through surgeries, how they're being seen by the specialist of specialists in my state for this particular kind of issue, all because they came to a screening and they got that expert view, and they're going to finish their sleep studies and, Lord willing, be able to sleep. Not just have the sleep apnea that they were diagnosed with and the central sleep apnea that they were diagnosed with by those wonderful experts, but they could get real rest. Think about how that could improve their whole entire life, not just their academics and their speech. Crazy but true. Sometimes just a little bit of a peek by a professional can do something really amazing. So if you have any concerns, any lingering doubts, feel free to ask. I will share with you a little known secret. There are a lot of private practices out there, and a lot of them offer free speech and language screenings. Sometimes they're teletherapy, sometimes they're in person if you come and visit. Sometimes you can schedule one at your homeschool cooperative. Really do investigate this, because it could be a really amazing asset. And I would hate for anybody to miss something big, especially if all it takes is 15 to 30 minutes of your time, or, an hour if you have a bazillion children like some of us, right? So definitely take a peek into it and consider that option. I know that I have started charging a very nominal fee that I like to apply to my evaluations, just so I can make sure that a family is really serious about getting that screening done, that they're very serious about their child's speech and language, and it also is respectful of my time. But in addition to that, you might get some really great ideas of how to go from there. Like I said with the first child example, I shared some particular resources to help them fine tune and hone. Don't worry about this sound just yet. Worry about that sound, because if you get that sound, the other one might just fill in magically. It's kind of wonderful like that. And when you have an expert giving their 2 cents, giving their opinion, that can work out beautifully. So just another thing for you to consider. One of the things that I am working to offer is a membership. So you can ask questions, you can get direction, you can get a review of which resources might be a better fit for your particular type of situation. And that is going to open up more and more as, if you may have remembered, I mentioned earlier, the Interstate Compact opens up. I'll be able to give even more specific help because there's certain boundaries based on licensure that I have to be respectful of because of my code of ethics. So feel free to keep an eye out if you would like to have that kind of back and forth relationship, somebody to be a sounding board. I would love to be that person for you. So feel free to visit me at illuminatecommunicate.com, which you will see in the next little bit of this presentation. www.illuminatecommunicate.com for all of those folks who will not be watching the slide presentation, but instead in the really amazing podcast, www.illuminatecommunicate.com, to find information on when I open up my membership waitlist, in addition to all my really cool courses that teach really neat strategies and also, some of the simpler things like how to do specific sounds. Those things will all be rolling out very shortly or have already started rolling out in the case of the strategies. So excited about that one. I could go on forever. But I just want to thank you. Thank you so much for coming to this webinar. It has been an absolute treat getting to chat your ear off about something that obviously I love probably a little bit too much. But don't you want your experts to be excited about something? I would hope so.